Assalamu alaikum wa rahmatullahi wa barakatuhu to those that are watching and those that will be watching within this conversation, and inshallah those that will be joining after the video has been posted on Facebook. I'm joined today with a beautiful brother of mine, Mobashar Rashid, who comes with from the background of healthcare, and we will be speaking on some topics related to mental health and the sort. But before I go into the discussion, I would just like to read some verses of the Quran so we can formally start, inshallah. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم قل أرأيتم إن أهلكني الله ومن معي أو رحمنا فمن يجير الكافرين من عذاب أليم قل هو الرحمن آمنا به وعليه توكلنا فستعلمون من هو في ضلال مبين قل أرأيتم إن أصبح ماؤكم غورا فمن يأتيكم بماء معين صدق الله العظيم. So Alhamdulillah, that was some tilawat of Surah Al-Mulk, the concluding verses of Surah Al-Mulk. And as I said at the start, I'm joined with my brother Mobashar Rashid to speak about healthcare. As you can see on the scroller below, you can follow him and the Lantern Initiative for more Muslim mental health related topics on Instagram. So do follow that and do see what that's about. Assalamu alaikum to those that are joining me, and assalamu alaikum to Brother Mobashar. How are you?
Assalamu alaikum. Alhamdulillah. I'm all right, thanks. How are you doing?
Good. Yeah,
You
alhamdulillah.
okay?
And I hope you and your family are
Good.
keeping well in this lockdown.
Alhamdulillah. Yeah, it's quite tough at the moment, isn't it? But I think we're all trooping on. Just to clarify, the Instagram link below is of a friend of mine, the Lantern Initiative, and it's got topics on there regarding Muslim mental health topics, short videos and links to studies and stuff. So definitely check that out, please.
Absolutely, inshallah. So there is something that he himself is working on, but that's yet to come, inshallah. So we can all watch this space and watch out for my brother Mobashar Rashid, inshallah. But this Lantern Initiative already has a lot of content on Instagram and on Facebook page, their own Facebook page. So do watch out for that as well. So my brother Mobashar, he is a physician associate, and he comes from the audiology background as well. So Mobashar, tell us a little about yourself and how you got involved with healthcare.
I got a little bit of that. Did you ask me how I got involved with it? I think the connection's breaking up a little bit.
Oh, okay, yeah, we do have that sometimes. Sometimes the connection is a bit poor, but yeah, what I asked was, how did you get involved with mental health and healthcare in general, and what's your sort of journey been in that?
Again, I'm getting a little bit. I'll try and answer it. Can you hear me okay?
I can hear you fine. Yeah, I can hear you perfectly.
Yeah. Okay. I'll just carry on then. So, how I got involved with it, I guess my parents always wanted me to get into healthcare, and so I kind of fell into audiology, which is a hearing and balance specialist. And then from there, sadly, with my own father's health not being great, it kind of motivated me to get more involved in addressing other aspects of patients' health. So I eventually did another degree, became a physician associate, which is a medically qualified healthcare professional. And essentially, we diagnose, examine, and manage patients.
So he has just left the building. He did say that his connection was poor, and I believe it cut off. So if I can ask him to come back on, inshallah, you can join the meeting again. Maybe he needs to sit in another place where the connection is stronger. I'm not sure where he is sitting at the moment. Let me see if I can add him back into the stream, inshallah. Assalamu alaikum. Are you with us?
Walaikum Assalam. Yeah, I'm just going to try and move somewhere else, and hopefully that'll make a difference.
Okay, no problem. Just let me know when you're ready, inshallah. We can start. Yeah. So as I was saying about Brother Mobashir, comes from the healthcare background, and as you know, I have been talking about that within my previous interviews, that I do want to speak on healthcare, and I do want to speak on different topics from different people of the community. So inshallah, today is a new start, inshallah, a new initiative to speak on healthcare as well. So I think I will get Brother Mubashir back on, inshallah. Is he okay to get started?
Yeah, let's get started. Okay,
Brilliant.
Sorry about that. Let's try that again.
No worries. I can see you more clearly as well. So I think we got a better connection now.
Good. Okay. So yeah, I was just saying, I went from working as an audiologist to then becoming a physician associate. And essentially, as a physician associate, we diagnose, examine, and manage patients. And the sort of work that I'm doing is working in a GP practice at the moment. We can choose where we want to go, but I chose to work in a GP practice.
Okay.
And so, as you can appreciate, we're getting to see a lot of things, including a lot of people with mental health related issues.
Absolutely, that's amazing. I'm sure you get to see a wide range of issues that within the community, working in the GP practice. And like you said, your inspiration was your father. Allah subhanahu wa ta'ala raise the ranks, inshallah. Ameen. Allah subhanahu wa ta'ala raise the ranks. That they were your inspiration to go further into healthcare. I believe you are doing your masters or just completed your masters. Is that right?
No. So I graduated in October. So I've been working since.
Oh, mashallah. So you did a BA degree in audiology, and then you went into this particular field as a physician associate in your masters. Is that right?
That's right. Yeah.
Yeah. So absolutely, that's brilliant. And so. What sort of work are you doing currently? You said in the GP, but then you're doing something online. You're doing work online. You're working with the Lantern Project. You did mention that at the start as well. So do you tell us a little about what you're doing currently as well online?
Yeah. So I guess one of the reasons of getting into all of this was because I saw a lot of the struggles that we as a family saw when we accessed healthcare, whether that be to do with cultural issues, religious or language barriers, and of course mental health is a big thing at the moment, with awareness being raised on it. But I think within the Muslim community, and as a South Asian myself, within the South Asian community, we can see that these topics are maybe more taboo and less understood by some people, not by everybody, but by some people. And so I felt, that there needs to be more awareness on it. So what I'm trying to do at the moment is to really increase awareness on mental health itself. On things, how to identify certain things, certain symptoms, what you can do in terms of helping yourself to prevent things escalating and when to get help. And with the Lantern Initiative, somebody approached me and got in touch and said, "Can you do a video for us on this?" So if you go on there, there's a short video by me talking about how to manage your mental well-being and all the different tips that you can use to maintain your mental well-being as well.
Yeah, that was I actually saw that, and based on that, that's when I contacted you, because I was looking to involve someone from the mental health and healthcare side of things, and that video is nice and short and brief and straight to the point. It hit a lot of good things that people can implement straight away within their daily lives, which is really really good initiative by the Lantern Initiative. And obviously yourself getting involved with them. Also, you have you're building your own Instagram page as well, which is the Northern PA. Is that right?
Yeah, that's right. Yeah, so as part of all of this, I'm eventually hoping to get some videos out there to address topics of mental health, nutrition, lifestyle. What I didn't mention is the fact that having grown up in a Bari, Mirbri background, I came across a lot of things to do with Ayurvedic medicine and Unani medicine, otherwise known as, from a Muslim perspective, Tib medicine. So
Okay.
elements of Tib are incorporated within our understanding of what's garam, what's tanda, what foods are good for us, what are not good for us. And that really motivated me to think outside the box and think, actually, you are in control of your own lifestyle. It's not only about genetics, and it's not only about giving a drug to somebody. What you do right now, what you eat, how you think, what you're exposed to in your environment, the things you think and say, can very much impact your health, whether it be your mental health or your physical health. So that's another reason why I'm doing this. And on the Northern PA, I'm hoping to get some videos on there to address nutrition and lifestyle and things like vitamin D, and the importance of it within the Muslim community, which is predominantly people of color, black and ethnic minority backgrounds, but obviously also white people as well. But as you're probably aware, vitamin D deficiency predominantly affects people that have dark skin tone. And so I want to address those topics because it's a massive thing, and it seems to be something that's not necessarily there's much awareness on it, and it can affect your health quite a lot. So that's my aim to eventually get into.
Absolutely. So you've got a very educational background, academic background, and you're sharing all of that experience and that knowledge on your Instagram page. Inshallah, Allah subhanahu wa ta'ala bless it and increase you in that. And those people that are watching, they should really follow that page with the Lantern Initiative as well, to get the Muslim perspective on these things. You mentioned Tib, you mentioned our cultural sort of take on things. What is garam, what's tanda? That's something that's often it's like mocked almost. The younger generation sees that and thinking what they're talking about, but really there is something there where we can tap into and we can use that, inshallah. So using your experience as an audiologist and as a physician associate, inshallah, there'll be a lot to learn and a lot to take from that page, inshallah. So something that you have touched upon anyway, that this current generation you feel that lacks, or maybe there needs to be a revival of something, or something that you like to see within the next generation, that they're more aware of it. What would you like to raise awareness for on your page? You've spoken about it. Do you feel that there is something that we can change within ourselves?
Yeah, I mean, like you said, I've touched up on it a little bit, and it's such an extensive topic, and there's obviously a lot that can always be changed. I think within the next generation, obviously, things on educating ourselves about how what we eat and what we do affects our body is really important to empower ourselves and to take responsibility for ourselves. And not just say, "Oh, so and so has diabetes, or they've had a heart attack," and yes, God has willed it, but there is an element of taking self responsibility as well. I did an essay religion, um, on religion and our attitudes towards our health, and one of the things that I discussed on it was it's called religious fatalism, the idea that I'll just sit down, eat my takeaways, eat my curries, eat my red meat, and if I get a heart attack or I get diabetes, God willed it. But the fact is that we know these things in moderation, okay. But when we eat too much of these things, which a lot of us do, sadly, we can cause negative effects to our health. And it's not just a matter of saying God willed it. It's a matter of actually saying, what have I done to try and prevent that in the first place? And we were talking about a hadith, weren't we, Hashim? And I'll let you just narrate that, briefly paraphrase it,
Yeah, of
because I
course.
was mentioning the hadith about the camel.
Yeah, so the hadith that is quite common within the public anyway. I'm sure a lot of people can relate to it, which is the Prophet ﷺ approached a person who was leaving his camel unattended, whilst not even tying the camel up, and saying that I rely on Allah subhanahu wa ta'ala to keep my camel safe. So the Messenger ﷺ instructed him to tie your camel first and then rely on Allah subhanahu wa ta'ala. And that's a phrase that we say quite a lot: tie your camel first and rely on Allah subhanahu wa ta'ala, using the hadith. So it goes very well with the sort of topic that we're talking about right now, where obviously the whole idea of a decree from Allah subhanahu wa ta'ala, destiny, all of that is written. There's no doubt on this. But there are certain things that Allah subhanahu wa ta'ala, within the decree of Allah subhanahu wa ta'ala, Allah does not intervene, or Allah subhanahu wa ta'ala will not change us until we ourselves get up and try to change. And that's a ayah of Quran as well. And there were a group of people in our history of Islam. This idea has come to me as you were speaking. Thought came to me. They were known as the Qadariya, and what they used to say is they used to believe that everything comes from Allah subhanahu wa ta'ala and we have no say in it at all. We have no choice. So there was an individual thief, and he comes and he takes from somebody's orchard, takes one of the fruit, and the owner of this garden, of this orchard, he's passing at the same time. He catches him and he says, "How dare you steal from me?" And he said, "You can't blame me. It's Allah subhanahu wa ta'ala wrote it. I'm just doing what Allah subhanahu wa ta'ala has ordered and has instructed and has written." So the owner understood where he's coming from. He goes, "Okay, fine." So he brought someone that will whip, and he said, "Whip him." So the thief started shouting out, "Why are you whipping me? Why are you whipping me? I only stole an apple or something, whatever. Why are you whipping me?" And he goes, "I'm just doing what Allah subhanahu wa ta'ala has wrote for me. I'm just following the divine decree. I have no right, no say in this." And the guy understood straight away that Allah subhanahu wa ta'ala has given us ikhtiyar, He's given us choice. And we choose our lifestyle. And with that, Allah subhanahu wa ta'ala creates the opportunities and the tawfiq to do that, inshallah. So absolutely brilliant.
Definitely. Just on the back of that as well, what is good and what is nice about this, about things like, for example, if somebody gets a terminal illness like cancer, and they've been told that you've only got a certain amount of time to live, or there's no cure. What the evidence shows is that people from religious communities, whether they be Muslim or any other religion, they tend to, because they have faith in God as well, they tend to cope with those situations better because they say, okay, now I can put this to God and God, I'm in God's hands. So there is a time and place for these things. Obviously, we should always put God first. But what I'm saying is that there is a time and place where we can say, okay, now it's in God's hands completely, and we have no power over this situation anymore. However, like you said, in terms of general health, it's not good to just do that straight away. Going from 0 to 100 is important to actually think that yes, it's in God's hands, but I have some responsibility too.
Absolutely, there is a balance, and there is certain responsibility on us to take care of ourselves first. And so it was asked, Sayyidina Ali radiallahu ta'ala anhu was asked, where is the balance? What is the balance? And he said to him, stand up. He stood up. And he goes, raise your leg. So he raised one leg, and he goes, now raise the other leg. And he goes, I can't levitate. I can't raise both legs. And he goes, that's where it is. You do what you can, and the rest is up to Allah subhanahu wa ta'ala. So this is what exactly you're saying. Alhamdulillah.
That's a good one. I've not heard that one before.
So Sayyidina Ali radiallahu ta'ala anhu, who inherited from the Prophet sallallahu alayhi wasallam's wisdom and knowledge, and Allah, the Messenger sallallahu alayhi wasallam said that Sayyidina Ali, I am the, referring to himself, the Messenger sallallahu alayhi wasallam says that I am the city of all knowledge, and Ali is gate and the door. So you want access to the prophetic wisdom and knowledge, then Ali radiallahu ta'ala anhu is your go-to person. So there is a lot of wisdom in the words of Sayyidina Ali radiallahu ta'ala anhu. But yes, going back to mental health and healthcare in general, there is a certain responsibility upon us to really watch out for it. There's, a lot of people, they'll be scoffing down all these burgers, and then at the end saying Alhamdulillah and Allah subhanahu wa ta'ala, give me good health. So really, we really need to watch our own diets and our own nutrition, and this is exactly what the Northern PA will be about, inshallah. I'm seeing, inshallah. One thing I will ask you about is, there is this big campaign right now about Black Lives Matter, and of course, it's a big issue. Not to play that down in any way. This is a serious thing, and we really need to stand up for justice. But we ourselves as a community are lacking in certain things as well. And why do you feel that there is within our community? Why do you feel that we're lacking in awareness for mental health? And what can we do to combat that? And where's the solution to this?
Mm-hmm. So obviously, with the Black Lives Matter movement, people may think that if they're not black, it has nothing to do with them, but that couldn't be further from the truth. But first of all, from a moral point of view, we have responsibility to address racism. But from a health point of view and a social point of view, we within our own community, as in whether it's South Asian, whether it's Pakistani, or whether it's Mirpuri, we have certain challenges, and those challenges have parallels with the black community in the UK or in America. All of us, and the statistics show that black people the most, all of us have less health outcomes, worse health outcomes compared to our white counterparts in the UK. Black pregnant women are much more likely to have an undiagnosed disease compared to their white counterparts, are much more likely to suffer complications during pregnancy, during labor, and the list goes on. Black men are much more likely to suffer a mental health illness and not get help, and when they eventually get help, it's much later, and so they end up being in mental health asylums much more commonly compared to others. The South Asian population follows a similar sort of direction, less so than the black community, but more so than the white community. The reason for this is very complex and very complicated, but what I will say to you is that it's steeped in history, which is why I'm so passionate about history and culture as well. It's steeped in our histories, it's steeped in colonialism, imperialism, and in the current system that we live in, which is to do with um, systemic racism, which is basically favoring in a system, creating a system in place where we're not addressing certain challenges to communities, specifically to my community, which would be, this I belong to many communities, but from a perspective, a cultural perspective, from the Mirbury community, I know from first-hand experience that we we have challenges in terms of language, in terms of the correct awareness being raised and targeted towards us in our own language, and in terms of education, um, and and what we were talking about before was the fact that um, we don't necessarily have access when whichever immigrant population it is that comes to the UK, we end up not being in these affluent areas, of course. We end up being in non-affluent areas.
Mm.
And with that comes challenges towards access to good quality healthcare, good quality schools, and all the rest of it. So we're already at a disadvantage, and that builds up over generations. And what we end up seeing is class differences. So what we generally see is that we can't always talk about race without class. Sometimes they're quite interlinked, and often, being working class and being of a certain ethnic background play a part in your outcomes. The first thing I learned when I did my degree was um, determinants to health, the things that determine your health. And the
Mm.
number one factor for determinants, well, there's many factors. The number one factor is socioeconomic background,
Wow.
your financial status. That's not to say all rich people live amazing lives, but it is to say that if you're more well off, and if you come from a more prosperous background, you have better access to education, better access to healthcare. You can afford to buy better foods, um, and all that results in better health outcomes. So it plays a big part. Sorry, I'm just checking if my charge is on.
Okay.
So yeah, I guess the overall thing to consider is that there's a lot of challenges within the communities, irrelevant of which community you're from, and even if you're from an English community, being working class means that you're going to have some challenges compared to your middle class counterparts. Um, there are always exceptions to the rule, but we're talking about in general as an overall concept.
Absolutely, absolutely. So this doesn't mean that a certain color of your skin determines where you are, but it's just in a general sort of what does statistics show, and is general principle, that and in speaking about this, we're not having a rant or we're not having a go at anybody. We're just trying to raise awareness for it within our own community and trying to help people within the public to try to understand this matter. And the first stage of fixing the problem is knowing that there is a problem. So, inshallah, I hope I hope that this message has got out to many people, and a lot of people have a lot to think. It's a lot of food for thought, I believe. So, in conclusion, I will be concluding it now. But if there is anything in your mind that you wish to say as a last message, then Bismillah, you can go ahead. But these, sorry, pause.
I was just going to say, just with regards to mental health itself, if somebody's low in mood, um, if they're getting thoughts of suicide, self-harm, if they've been through things, if they've experienced bullying, uh, family politics, whatever it may be, we're only human. What I would say is get help. Um, because of all the challenges that I've mentioned, we as people are very poor at sometimes getting access to healthcare and saying, look, I don't feel good, and can I get some help? So it's very important that you go to your doctor and get help. And I just wanted to mention just a quick 4 points about what you can do in
Absolutely.
terms of your own health as well. Um,
Absolutely.
yes, we talked about food. Uh, it's not just about fruit. We love fruit, but it's about increasing your vegetable intake considerably. Yeah. So, um, green vegetables and eating the rainbow is often what we say. Getting plenty of nutrients from nuts, salmon, oily fish once a week is really good for the brain, omega-3. Um, Taking supplements is really important. Vitamin D is very important. Everybody should be on a vitamin D supplement, especially in winter. That's the current recommendation, that we should all be on a vitamin D supplement simply because we're not getting enough sun. Vitamin D affects our entire body systems. It affects our health in many ways, including our mood. Um,
Yeah.
Find somebody in your family that you can speak to. Uh, Mental health is often a taboo subject, something that we feel embarrassed talking about,
Mm.
especially if you're a man. It's almost like get on with it and carry on, but it shouldn't be like that. So create an environment within your own families where you're forwarding the idea that actually it's okay to talk about how you feel. There's plenty of examples of how the Prophet, peace be upon him, fostered those relationships about talking about how somebody feels, and how um, transparency is really important. So it lets people that love you care about you, yeah. And yeah, it might feel awkward the first few times, but eventually you'll reach a point where you can engage with each other and talk to each other about things. And that's part of just being a family, to be able to talk about things. And exercise is really important, very, very important. I can't stress how much. Even if it's 5 minutes of cardio, of running around the block or going to the park, do it. You might think, what's 5 minutes going to do? It's going to make a massive difference. And how you build a habit is by starting low and then building up. But 5 minutes itself is enough. And finally, just make sure that you do read up on this topic as well. It shouldn't be a taboo subject. It shouldn't be something that we fear. Um, and if you feel somebody in your family, whether it's your sibling, your parents, your children, are going through something, get that help. There's nothing wrong with somebody having a mental health related issue, because it's part and parcel of life. We go through things, and sometimes we need help with that. So there's nothing wrong with it. It doesn't make you any less of a person for having these things, and we need to understand that. So yes, sorry, I know I've gone on a bit, but I think it was really important to just address that as well.
No, no, no. I'm very happy that you did, because I remember when we were talking about issues within our community, I was thinking that's painting a very bleak sort of picture, and people are may feel very negative at the end. But alhamdulillah, you finished on a positive. So things that we can take from it, and where we can start the change, inshallah. And it's always important to start the change within ourselves first. So actually, it's interesting. You remember you mentioned these things, because I now remember where I got the idea from. I've started having these multivitamin tablets. They're not. They're not.
Good.
It's not vitamin D as such, but it's got vitamin D within it, and also I'm the greens. The whole idea with vegetables. I was a kind of fruit kind of person, um, but I've switched. Well, not switched. I'm taking vegetables as well.
Good,
I can't
good,
stay away
yeah.
from my fruit, but I'm inshallah trying to incorporate that
Maharshi,
with
that's
myself.
great. And I think I don't say this that as if I've perfected it. Might work in healthcare, but we're only human. And I eat takeaways and I eat fruit sometimes. But I think what we're getting at is telling you about what the research shows, what's good, what's important, and then for you to make a decision daily about what you're going to do with it, and knowing what impact that's going to have. So for example, if I decide to have a takeaway one day, if I decide to have a takeaway 3 times a day, I know in my mind, okay, that's going to have a negative impact on me, but I've consciously done that and I've made that decision. But then I've made an informed decision, and the following week I might not do it. It's just about getting people to make informed decisions about what they're doing, what decisions they're making every day, and not saying that live this perfect life, because we can't. It's hard. but it's just saying try and make an informed decision about what you're going to do each day. We may not make the perfect decisions every time, but at least you'll be aware that actually I've maybe not made the wisest decision today. Let's try again tomorrow, and that's simply what it's about.
Absolutely, absolutely, and like you're saying, we sort of this world, we kind of get plugged into it, and we live very passively. We just go with the system, go with what's the routine is. But I'm sure in this lockdown, we've all had the time to think and reflect on our life, and to sit back and think, where are we going, and where am I going? So, inshallah, I hope there's a lot of food for thought, a lot of moments of reflection within this discussion that we've had, and where he spoke about taboo, this whole idea about you don't have no problem, be strong, be positive thinking, don't let something that's within your mind bring you down, be strong and overcome it. That's true, it's 100% true, mind over matter and all of those things. But there's no harm in accepting that you might have some thing that you need help to you need to receive some help. And the Prophet ﷺ said, where in regards to being taboo, modesty is a massive aspect of Islam. Modesty is, there's no such thing as too much modesty. But the Prophet ﷺ said, in seeking knowledge, there is no modesty. Because if you are modest and I have sharam and I have haya in asking this question, then you will never know about it. You'll never know the answer. So there is no modesty in seeking knowledge, and we're trying to create an awareness, inshallah. And hopefully within the next generation, we see a big revolution and a difference in the way we group and the struggles that we had, and inshallah within the next generation. These interviews that I've held with different people, some were from the Nath Khan field, some were from scholarly field, some were running educational centers, and now today we are within healthcare and mental health, more especially. Where do you really see this going? A lot of people have asked me, what's my motives, what is my agenda? Where would you like to see these interviews go, and how much can we expand it?
It's a hard question because there's obviously so many things that we can cover, but I think overall it would just be to ensure that we foster a sort of educational sort of space for people so that they can engage in these conversations and really understand on their level what things are out there, what things need to be addressed, what they can take from these things. Sometimes it's really important to have people talk from your own communities rather than hearing it from somebody that's not from your community, and it can help people understand things a lot more. So for me, I would see this going in the direction where people are a lot more engaged because it's people that are speaking on their level from their own communities, and we will eventually see a community of people that's a lot more empowered and a lot more healthier, whether that's spiritually, mentally, or physically.
Absolutely, inshallah we can all say amen to that, and I'm sure we all wish and want for a brighter future, and some of those things that we want are within our hands and within our grasp, inshallah, and Allah subhanahu wa ta'ala facilitate us in this. Who would you like to see within the next sort of interview? I have some planned with other people, but generally speaking, what sort of interview would you like to see in a similar sort of setting that we've had today?
A couple probably. One would be, if it's healthcare related, probably nutrition and psychosis is an important one. When we hearing voices and the Islamic perspective, but from a healthcare and Islamic perspective intertwined, rather than just and looking at the cultural elements of that. So I think those two things, nutrition and psychosis. From a religious point of view, I'd really like to see some discussion around why different views exist within our religion. Often people kind of get worried or scared, or sometimes become very defensive as to why a certain view exists, and or a different view exists. And I think having that knowledge about why various views exist and how they exist is really important.
Easy. Inshallah, that is something that can be discussed and can be arranged. Inshallah, it's, you know, these conversations that we have, they sometimes semi-controversial, semi taboo, but at the same time we're trying to bring ourselves out of that and really discuss the matters that people are actually asking, but it's not being discussed in a environment of education, of knowledge, of awareness, from people that are maybe off that field where they can talk on this, inshallah. So that and this word that you mentioned today, psychosis, I've not heard of it. So inshallah, it'll be an opportunity for me, but opportunity for a lot of other people that are watching to go and research what this is, and hopefully we can have a discussion on this as well. Jazakallah for your time and for the knowledge and experience that you've shared with us. Hope it's been blessed for everybody else and beneficial as it has been for myself. Assalamu alaikum wa rahmatullahi wa barakatuh.